Hi, I'm Dr. Charlie Liu. I'm a GP at Summertown Health Centre in Oxford, and today in this video I'm going to be talking to you a bit about the medication options for treating migraines. So if you're watching this video, this is mostly going to be about the medications. There are various dietary and lifestyle tips that do make a big difference with preventing migraines. I'm going to assume that you've probably tried most of that stuff already, and I won't talk about that. But if you haven't, I will put some links to various websites and resources in the description below, so you can have a look at those. As with anything in medicine, we always try the lifestyle stuff first before we go for medications, so do give that all a try. So, the medication options for treating migraines fall into three broad camps. One is the painkillers, two is the triptan medications, and three are the preventative medications. Which ones we try depend a little bit on how frequent the migraines are, or how bad they are, and whether they do respond to painkillers well or not. So if you're a person who has relatively infrequent migraines, maybe they just happen every few months or so, then quite possibly we're going to be using the painkillers and the triptan medications in order to just treat them when they happen. But if you're a person who's suffering from quite frequent migraines and they're quite debilitating, let's say you can't work when you have one, then we also have the option of trying a preventative medication that you would take on a daily basis to hopefully reduce the frequency of the migraines. So we'll start off with the painkiller group, which is the simplest one. So there isn't anything particularly special to say about the painkillers. Most of the painkillers that are available will work for migraines to some extent. So paracetamol, anti-inflammatories like ibuprofen, codeine and other opiate medications, and aspirin are all used in the treatment of migraines. If you're having migraines quite frequently, we generally advise you try and stay away from any opiate-based ones, because sometimes we can get a bit of a rebound effect if you're using them too frequently. Aspirin seems to have a little bit of evidence that means that it works quite well for migraines, and we use a high-dose aspirin. So the typical low-dose aspirin that we use for heart disease, for example, is 75 milligrams, but we actually use the 300 milligram tablets in the treatment of pain caused by migraines. So this is about 4 times as strong, and you can actually take 3 of those 300 milligram tablets at a time, up to 4 times a day, which sounds like a whopping dose, but as long as you don't have problems with stomach ulcers or stomach bleeding, then it's not a problem. So that can be quite useful for the treatment of migraines. One of the things that we often come up against is that people who suffer from migraines get a lot of nausea and vomiting. It's one of the key features, and so we often will prescribe an anti-sickness tablet just to make sure that you do actually keep those painkillers down. Otherwise, if you just vomit them up, they're not going to work. So if you find that nausea and vomiting is a big problem, then do talk to your GP and they'll probably co-prescribe you some anti-sickness tablets. The second class of medications are the triptan medications. So these are quite useful, particularly if you have infrequent headaches. Sumatriptan is probably the most common one that we prescribe. And this is a medication that isn't a painkiller exactly, but you take it at the beginning of a headache, or if you have auras and you kind of know that one's about to come on, hopefully you can take it even before the pain starts, and hopefully it stops it in its tracks and just stops it from arriving in the first place. So that can be really useful as a kind of cut-out medication whenever the headache is just about beginning. And if it partially works but doesn't completely work, then you can repeat a dose about 12 hours later, a second dose, just to see if that helps. If it doesn't work after the second dose, don't carry on taking it because it's not a painkiller. The third class of medications are the preventatives, and there are quite a few of these different ones. So I'm just going to talk about a couple of the most common options first, so you know what to expect. So probably the most common options that we use are beta blocker medications, Amitriptyline, which is a tricyclic antidepressant, and a Candisata, which is a blood pressure medication, or an ARB. So let's start with the beta blocker medication. There are various beta blockers that can be used in migraine medication. Beta blockers work by counteracting the adrenaline part of your hormone system. So that part of your hormone system that drives the fight or flight reflex and causes adrenaline to pump, it essentially blocks those receptors, and therefore it kind of lowers the blood pressure and lowers the heart rate a little bit, and that can be helpful for using a migraine. The side effects of a beta blocker are mostly related to those symptoms, so you might find that you have slightly cold peripheries, hands and feet. You might find that in the winter that might be troublesome. And some people find that because it slightly lowers the heart rate and the blood pressure, they might not be able to exercise quite like they used to and hit 100%. for people who already have a low blood pressure or a low heart rate, sometimes we don't use this medication first. The second medication that we use quite commonly is amitriptyline. So amitriptyline is a tricyclic antidepressant. A lot of people, when we're prescribing migraine medications, they think, why is this an antidepressant? Does that mean that they think I'm depressed and I'm making it all up? That's not the case at all. So amitriptyline is a medication that we do use as an antidepressant, but in much higher doses. So for depression, we'd typically be using anywhere from 50 milligrams all the way up to 300 milligrams. But we do use it also for neuropathic pains. So these are pains that are derived from the nervous system in some way. So we use it in people who have diabetic neuropathy in the feet, where the nerves in the feet are kind of fried by the blood sugars. We use it in migraines. We use it in problems where there's a disc pinching in the back, in sciatica, for example. And typically for those conditions, we use it in much lower doses, so anywhere from about 10 milligrams to 50 milligrams, so a completely different dose range to the antidepressant effects. Amitriptyline, the typical side effects that we see are in the group of side effects that are called anticholinergic medications. There are a few medications that fall into this group, and those include things like dry mouth, difficulty urinating, constipation, and drowsiness. In people who suffer from memory impairment or dementia, it can also worsen memory, so we make sure not to prescribe it in this group in general. The dry mouth is quite a common symptom, and actually we use that as a bit of a marker to see whether it's working or not. So typically we'll start off at the lowest dose, which is 10 milligrams, and we'll say every week increase it by another tablet. So start off with week 1 with 10 milligrams, week 2, 20 milligrams, week 3, 30 milligrams, etc. And then at the point where you start to feel like your mouth is a bit dry, that's when you know it's working and you can stop there. So if you get to 20 milligrams and you feel like your mouth is getting a bit dry, then you can stop there and just carry on taking that dose. And usually that's quite effective. Amitriptyline also has a side effect of being a bit drowsy. It's mildly sedative. So we obviously take it at night time. Some people find that that's really useful because they might have trouble sleeping anyway. And often if you do have a migraine, obviously you've got a lot of pain going on and you're trying to feel sleepy and go to bed. So the amitriptyline can actually be quite helpful there. But this is a medication that you take every night time before you go to bed. Some people find that it lasts a bit longer than they sleep, so they might find that they feel a bit drowsy and a bit almost hungover in the morning. So if that's a problem, do let your GP know, and we'd probably try an alternative medication. And the third tablet that we quite commonly use is one called Candisata. So this is a blood pressure medication that many people are on for treatment of blood pressure. And again, it seems to work on the vasculature, the blood vessels, and so that kind of reduces the frequency of the migraines. The main side effect there, again, is that it drops the blood pressure. That's its main purpose. So if you already have low blood pressure, that's something that we need to keep an eye on quite closely. If you start to feel lightheaded, dizzy, then that's probably not an option for you. But there are lots of other preventative medications, and there are even some new medications that are coming out now, some quite funky ones to do with antibodies. So if you find that migraines are really troublesome for you, don't lose hope. There's a lot of different options out there for you. But do ask your GP about the different options today. If you find that you're not having the migraines that frequently, perhaps ask them for a painkiller or a triptan medication. If the migraines really are happening very frequently, then perhaps we're looking more at the preventative medications that you take every day. Well, I hope that's been useful for you, and I'll also put some links into information about those different tablets so that you can have a bit of extra read and a bit more information for you, and hopefully that is helpful. Have a very nice day.